I am Dr. Vidyadhara S, Head of the Department and Consultant Spine Surgeon at Manipal Hospitals, Bangalore. We nowadays come across lots of patients with spinal infections, especially tuberculosis, which we were supposed to get eradicated from this world, is actually come back with a vengeance. Maybe partially it is because we have bad food habits and lack of immunity, because of which we are more prone to infections. And secondly, also the bacteria is becoming more and more virulent and very aggressive, and nowadays we encounter more of MDR tuberculosis, that is multi-drug resistant tuberculosis, and also in immunocompromised patients such as AIDS, these incidence of spinal infections is much more. The other area where we get spinal infection is patients getting operated in smaller setups with not very hygienic setups. There is a higher incidence of infection, which we will have to relook as to how bad or how much damage it has caused, and then treat it accordingly. Most of the spinal infections can be treated medically with the use of either IV or oral antibiotics. However, if it comes to the point of risking your neurological structures in and around the spinal cord, we may have to intervene with the surgery to decompress and stabilize the bone. But having said that, even with surgery, the ultimate treatment is medical, and a long-term antibiotic is a must in cases of spinal infection. And normally, if it is a pyogenic or pus-forming microorganism, we give antibiotics intravenous for 6 weeks and oral for 6 weeks. And if it is tuberculosis of the spine, the treatment can range from 9 months to 1.5 to 2 years. And here, again, the emphasis is on proper diagnosis, for which a biopsy is a must. A lot of patients get treated empirically as tuberculosis, and ultimately, when the drugs don't work, we have very less choice of treatment. And that is why we always do a biopsy, so that you have a proof that whether it is tuberculosis or pyogenic. And secondly, with the present day norm of gene expert test, you get a fair idea as to whether the drugs that we normally use for treating tuberculosis are effective in the case that has been biopsied. And it is almost always curable. The spinal cord infection doesn't lead to any morbidity or mortality if treated adequately and appropriately.